Hi everyone, it's Taylor Divatini back again, updating you on my rhinoplasty and septoplasty operation I had around 3 months ago. Now I can't believe 3 months has gone already, and a lot of things have happened, a lot of things have changed in those 3 months. So I thought, well, a lot of you are requesting an update, so I thought, well, here you go. Like I said, it's been around nearly 4 months since my operation that I had done in my hometown, which is Perth, Western Australia. Now, as mentioned in a previous video as well, my surgeon was Dr. Chuan Pham of Royal Perth Hospital, and a Dr. Chow, who was my registrar at the time also. My experience was a little bit rocky, you know, with the operation or the surgery side of things. Recovery not so bad though. I found that around the time of having the rhinoplasty done, I had a lot of congestion more so than pain. It felt like I had a sinus infection. So if any of you have had a sinus infection before, you'll know that it's not too fun. But really it wasn't as bad as I thought it was going to be pain-wise. At the time I was on about 3 or 4 different types of medication, one being a steroid. Now I've said in the past that those steroids were absolutely, I don't know, I didn't really enjoy taking the steroids. It made me extremely hungry 24/7, 24 hours of the day. I was also on pain medication which was OxyContin, oxycodone, which is a type of a tablet form of morphine, you can say. Well, it's not as strong as morphine, but it's right up there. So I had that, and that really helped with the pain. I also had antibiotics as well to help with healing, and that really helped. So I was glad that I was on those combination of 3 or 4 things, which really helped with my recovery. Around the time of my recovery, I experienced a lot of bruising around my eyes. I looked back on other videos of other people's experiences of having the same thing as I had rhinoplasty done, and in comparison my bruising wasn't too bad, so I'm very thankful for that. I had a bit of discoloration under the eyes, a bit of yellowing, a little bit of purple. I didn't get any bursting of the blood vessels in the eyes, which was nice because I wasn't really looking forward to that. One thing, I had a little bit of a gum pain, like a toothache as such. I had a swollen lip, and around this area of my face and lip was very numb, which has come back now. The sensation's there when I feel it. It's pretty well 100% back, so that's great, I think. Now to the look of my nose, as you can see, it is so much straighter. If you look back on my first video I recorded on the day of my surgery, you can really picture the difference. Now on half the screen I'm going to put a little bit of that so you can have a look of what it was like, and then you can see the immense difference that the rhinoplasty and septoplasty has done for me. I'll get a little bit close up here to see. What I had done is I had the nose straightened because it was extremely bent, because I had broken my nose numerous times by being hit in the face with basketballs and people waving their arms around, and because of my condition I was more likely to get injuries and breakages of the bone, so that's why my nose had been broken so many times. And as you can see, it was very, very, very bent and almost on a diagonal. So for instance, if I was going to take a photo, my mum used to say, "Taylor, put your head straight, straighten your head." I said, "I'm not, my head's straight on." The illusion was from my nose, it was making my face look like it was to the side. So what I had done was, I had it straightened, like I said, trying to get straight on for you. There we go, it's nice and clear. Now as you can see, it's not bang on straight, and my surgeon told me at the beginning, because my nose was so badly broken, it was never going to be 100% straight, but he was going to do everything he could to make it as straight as he could, and he really did that, and I was really happy with the result. So I'm sitting straight on now, and it's pretty damn good. So that is so much straighter than before. And I also had the tip reshaped or shortened, because as you can see on the side, I'll sit this way for you to see, it's been chopped at the end. I think my surgeon said I had about 2 centimetres cut off the end of my nose, which is a huge amount, and I really noticed the difference when it started to heal and everything started to go down swelling wise. I look on this side, you can tell as well that it's a lot straighter. I had a bump removed from the side as well, and that's pretty much gone. And you can see here where it's been sliced off the end. And they also reshaped my nostrils as well. So, because I had really large nostrils, a large nose, large nostrils, and very, very small airways. So what they did while I was under as well is they cleared all my sinuses out. They reinforced this side of my nose with cartilage that they took off from when they took a portion of the nose off the end. So they used that cartilage left over to rebuild this side of the nose. Because what was happening was every time I went to breathe in or inhale, this nostril would just collapse in, so it would shrink and no air was going in or out. And because I had a lot of damage on this side as well, that side was partially blocked, so little to no air was getting in or out of my nose, which was making sleeping very difficult and everyday life just a bit of a pain. So that was fixed, and now you can see from this level, it's not my most elegant look, but you can see from this level, this angle I should say, that the difference is incredible from what it was before. Like I said, it's not 100% perfect, but I never went into this thinking that I was going to come out with a perfect nose, because from what I had before to what it is now, I'm very, very impressed and very happy with the result. So you can see what they did was they cut a little V in the nose here. They would have peeled it back, done everything that they needed to do with the bones, shaved the end off, stitched it up, and stitched it all on the inside, so there's no external scars apart from this little one here, which is barely even visible, as you can see, and it's so much straighter. There's no blockages on this side anymore, nor the other. Wow, that's a close-up. I'm trying to think if there was anything else. I'm sleeping so much better. Another thing that I didn't really think of to begin with was wearing reading glasses and sunglasses. Before I had the surgery, because my nose was so bent, putting glasses on was a bit of an issue because they would sit off center. So now I've noticed that that's improved as well. I can wear my glasses on my face now. And as well, my nose before I had the surgery was so large that it was in my vision. So when I would look to the left or to the right, because of its size, it was partially blocking my view, which sounds ridiculous, but it's true. And it's amazing to be able to look left to right and not see my nose in view and drink out of a glass without it getting in the way. And it sounds humorous, but it was really, that's what was happening. I mean, if you're not happy with something about yourself and you want to change that, there's always options out there. I had to wait a long time to have my surgery done, approximately 3 years, because there was a really long waiting list. But like I said, if you want to have anything like this done, I think go for it and go for it. I had mine done because it was affecting my everyday life, but I'm not going to deny that I wasn't a little bit self-conscious of my nose to begin with. I noticed in photos I also used to think, oh, should I Photoshop that? Oh, don't use that one, it's not very nice. Oh. And now I don't think like that anymore, and it's definitely boosted my confidence. I'm not going to deny that. But I want to clarify that the main reason for having my surgery was because of my breathing difficulties and because of the fact that it was so damaged inside and out. So that's the main reason why I had mine done. But I'm just saying, if there's anybody watching this video that's having theirs done for pure cosmetic reasons, I think that everyone has their own choices in life. And I think, well, if you get that opportunity and you really thought about it and you've done all your research, because that's really important as well, I think go for it. I think it's not as bad as it seems. It is a long recovery. For instance, my nose is going to take approximately 6 months to 12 months for all the swelling to go down. What you see now is not the final result by far. There's still a lot of swelling going on at the tip and at the bridge here, and just here I find is quite swollen as well. So I have to do daily massages to try and bring that swelling down. So there's a lot of post-op things that you've got to do to get the result that you want, but I definitely think if you really want to do it and you're passionate about doing it, or if, in my sake, it was really a necessity, then I think definitely go for it. Jump at the opportunity and don't look back. I apologise for not making this video sooner. The reason why I've left it so long is I taped a video as soon as I got my plasters off at the end of last year. There wasn't really a lot of difference, and I wasn't really confident with showing everybody at that time because it was still a lot of swelling and bruising, and I thought, well, it's pretty much exactly the same to my previous video, which was just the same yet with my plasters on. So I thought a more impactful video would have been to wait, which is what I've done. So now I hope you can see the results that I'm seeing and the fact that I'm really, really impressed with it. I'll happily make another video in a couple of months' time if you all wish, just to see what my nose looks like at the 6-month mark and the 1-year mark, which is when my surgeon informed me that the swelling should have gone down pretty much all the way. So if you'd like me to do that, I'll be happy to do so. But for now, that's about it. Like I said, if you want to ask me any questions, feel free to message me or email me. I'll leave my contact details in the down bar. But that's all for now. Thank you for watching my video, and stay tuned for more in the next coming months. See you later.